Good evening and thanks for joining us. We begin with what advocates hope is a moment of reckoning for something that's been ignored for years in this country, the failings of long-term care. After decades of neglect, it's taken a pandemic to finally put the problems inside our care homes into sharp focus.
We're stopping at nothing because the stakes are too high. We will do whatever it takes in our power to protect our most vulnerable seniors and ensure they get the care they deserve.
In Ontario, after those disturbing military reports about conditions inside some care homes, the province is now sending out more inspectors and taking control of 7 hard-hit facilities. In Quebec, officials are rolling out a major recruitment campaign for more staff after years of warnings about chronic staff shortages. Long-term care is a provincial responsibility, but Canada's Deputy Prime Minister says improving it is everyone's responsibility, and all options to reform it, including ownership structure, she says, are on the table.
All options must be on the table when it comes to how care for our elders will be provided. I think it is clear to us all that root and branch reform is necessary. We need to act with speed, but not haste, and work with our provincial partners.
The Prime Minister is holding a conference call this evening with the premiers to talk about what can be done. David Akin looks at some of the options on the table.
We have a unanimous position, all the premiers of the different provinces.
Indeed, they unanimously agree fixing long-term care needs more money from Ottawa.
We want to change the system, a broken system that's been around for decades. We need money. That's what it comes down to.
We're telling Mr. Trudeau, if you really want to help us in long-term care facilities, please increase your transfer in help to all provinces.
But experts say more money alone is not going to fix the problem. In addition, the federal government should draw up legislation that will set national guidelines and national standards for all levels of care.
I think that we actually have to start with something that looks holistically at seniors' care, because home care, like long-term care and retirement homes and assisted living, they are all part of the provision of seniors' care.
On Thursday, the Canadian Medical Association urged Ottawa to set national standards on staffing levels, working conditions, personal protective equipment for staff, and new reporting and data collection so that different jurisdictions can be compared.
We really have a patchwork of approaches that depend on the jurisdiction, the province, the territory.
The federal NDP has another fix: ban for-profit long-term care facilities.
In the for-profit model of care for seniors, there is more emphasis on the bottom line than care for seniors. Will the Liberal government admit that there is no place for profit when it comes to the care of our seniors?
There is, in fact, some research that shows, in general terms, some differences in death rates and illness at for-profit care centers versus those run by non-profits, municipalities, and charities.
Many of the outcomes that we're trying to address with long-term care are worse in for-profit facilities.
But most importantly, for advocates and for families, is that this crisis finally sparks some change.
This is our time of reckoning. This is actually the moment where we have to focus on making sure that it gets better. Enough is enough, really.
David Akin, Global News, Ottawa.
Any major fixes to long-term care will take time, and the thing is, lives are on the line right now. In Quebec, some care homes are under so much strain, the Premier has asked soldiers deployed in them to stay until September. The Defence Minister says that's likely not possible. As Mike Armstrong explains, they just don't have enough trained employees to fill the gap.
He's already been turned down, but Quebec's Premier isn't done asking. François Legault has been told that for the Canadian Armed Forces, keeping the soldiers working in residences isn't sustainable. But he says he'll be talking to the Prime Minister about it in Thursday evening's conference call with the premiers because the soldiers are too important to lose.
After June, we need them. So what will they do if they go away? I guess they must have something more important to do. What it is?
It is not a long-term solution. It is.
Speaking in a UN online press conference, Prime Minister Trudeau today said the Army's presence was always supposed to be temporary. They were a stopgap. The problem is that gap still exists. More than 9,200 workers from long-term care centres in Quebec are still off the job due to COVID-19. What Quebec is hoping is to hold on to the Army until September 15th while it finds and trains new employees. 10,000 orderlies.
You know, in life, when you don't think big, you have nothing. So we are thinking big.
The first part of that effort is international. The province is hoping to attract orderlies working in other countries to move to Quebec. That campaign launches next week with a goal of 550.
For sure, now the borders are closed, but Quebec government will be ready when the borders will open.
The second part of the plan is a hiring binge. The government is opening up 10,000 positions for orderlies starting at $49,000 a year. The school board administrator says students wouldn't be getting the normal amount of training. Instead of 870 hours over 7 months, it would be just 300 hours, some of it on the job. That would get new people into facilities as quickly as possible. Now, solving one problem is causing others. The new higher pay for orderlies throws a lot of the province's pay structures out of whack. Nurses with years of training would start at a lower salary than a brand new orderly. Mike Armstrong, Global News, Montreal.